As we're approaching the second day, the end of the second day for the 27th meeting of the European Society of Thoracic Surgeons, I have the honor to have together with me Professor Gilbert Massard, the President of the European Society. And of course, welcome, first of all.
Thank you.
Thank you very much for this interview. And we know that you really had and did very hard work with the program committee and all the committees of the Society to organize this event, a highly educational event with many people attending. Just tell us a few words. What can someone expect if they are here?
That is an excellent question, and I thank you for asking it. I think you were a little bit reductive saying that it is a big education event. It is true that our society puts emphasis on education, but the main goal actually of such a meeting is also to communicate on science. And the main part of the program is a scientific program. That means that our members send in their scientific work in the format of abstracts. There is a reviewing done by peers and a rating where we list all the abstracts by a score that is obtained by each work, and we select, of course, the best one for the conference. So this is a guarantee for our members that they get beforehand priority information on anything concerning innovation, new pathways of treatments, new ways how to secure safety of patients, and so on. Then the second objective, as you mentioned appropriately, is education. And in this year's program, we point out which are the sessions that are more organized in an educational purpose. This may be during the full-day program, but there is always a particular area that has existed forever, which are the early morning sessions that we call now the Sunrise Academy. And then beyond of this, we have some innovation this year that has existed as an embryo during previous years, but which has really exploded this year to a full-term pregnancy, if I can take this comparison. That is our training village, where industry shows up in the exhibition hall, no longer distributing post-its, pens, chewing gum, but organizing hands-on sessions available for all of our members. That is what we call the ESTS Training Village, and I invite anybody to visit this and maybe even to give feedback to ESTS leadership, so that we better know what was right, what was wrong, and what we can do even better next year to match with the need of our members. Anyway, for industry, it is interesting to watch how surgeons use devices, implants, and other things. And for members, it is interesting to get advice from the sales managers. What is the appropriate use of different tools and what is not? So this is the kind of absolutely perfect, how would I say, cooperation between industry and practicing surgeons. Hopefully that this will also imply that industry might make some changes to fit better instruments to the needs. That was what we were talking about, education, but there's perhaps a third aspect that is very important as well, that is everything that concerns advocacy of our profession. What does this mean? Well, we have a lot of threats from outside, contests from patients, fights with administration, questioning from health insurance companies. And everything what our association is doing in this field may help our members. I take for examples, we have set up a European syllabus on thoracic surgery which determines the perimeter of our specialty. So the area of competence of our members is very clearly defined. We have guidelines for many fields in thoracic surgery and pulmonary medicine. This again is protecting both the patients who get care according to these guidelines, assuring them security, pertinence of care, and on the other hand, for the surgeons working within the framework of these guidelines, it's also protecting their securing their personal liability. What else can I say? We have something tremendous, which is the ESTS database, which is an instrument where you can assess your own accuracy in treating patients, because for any procedure you can assess in a few mouse clicks what is your mean mortality rate, complication rate, and so on, and compare this to the mean of the database. So these are some examples how actually we try to improve the fit of what is offered to the needs of practicing surgeons. Science, innovation, continuous professional development, and advocacy of the profession.
And in the effort of globalizing the society and expanding it year by year, you also collaborate with other societies throughout the world, and you have also signed a memorandum of understanding.
The snapshot we got today is that this year's conference gathers more than 1,300 thoracic surgeons. That is a never obtained target, because this is the pure number of surgeons without any, how would I say, without counting the representatives of different companies, who add still 100 or 200 people to this list. Then it is also interesting to see that these 1,300 surgeons come not only from 27 European countries, but from 68 countries worldwide. That means that the European Society of Thoracic Surgeons has become a lead worldwide. It is not only the old European continent, it is North America, it is increasingly South America, it is steeply increasing from the Asian side. So we are in a process of globalization where ESTS stands really as the sole worldwide company for general thoracic surgery, because all other competitors, be it the EACTS in Europe, be it STS or AATS in North America, are mixed companies combining cardiac and thoracic surgery. This is a tremendous achievement for a society that is only 26 years old. So the next development, of course, is to find synergies with other societies, with other surgical societies that is sound, because we are in one profession, we are one family. So we have a long-standing cooperation with the North American societies. We have a long-standing commitment to different national societies. If you look at the roster of our society, we have all these national regions, which are people appointed by national scientific organizations. All this makes already something that works well, but it is still concentrated on thoracic surgery. So what is interesting for us now is in an area where multidisciplinarity is becoming a legal obligation in many countries. I take the example of France. You cannot treat any longer a patient with cancer without presenting him to a multidisciplinary tumor board with presence of a medical oncologist, a pulmonary physician, and radiation oncologist, and maybe a pathologist, a radiologist, and so on. That means that for the upcoming generations, it will no longer be possible to just sit in his or her office and deciding on its own what will happen to a given patient. So we have to follow or to precede even this kind of evolution and develop agreements, synergies with appropriate European societies. And as such, I think the most sound cooperation for a thoracic surgeon is cooperation with a pulmonary physician.
Yeah.
You agree? And so we are very happy that we came to an agreement with the European Respiratory Society, which is, well, representative of the European pulmonary medicine, but above all, the world's largest society for pulmonary medicine that exists. The pending conference in Madrid, end of September, is expecting something like 23,000 delegates from worldwide. So to have the privilege of signing a memorandum of understanding with this society is something that is absolutely fantastic, an absolutely fantastic opportunity. Why? Because first of all, we are the smaller brother in this kind of family, but on the other hand, injecting something like 1,500 thoracic surgeons into a respiratory society is a fantastic opportunity for us as surgeons to communicate with pulmonary physicians and to influence also a little bit their thinking and their decision making. On the other hand, for this minority of thoracic surgeons, having contact with all the subspecialties of pulmonary medicine will increase our own professional development, being able in one conference to learn about oncology, to learn about respiratory failure, about intensive care in respiratory medicine, respiratory infections, pulmonary hypertension, sleep medicine. All these areas are crossing with our daily practice, and for our members, this alone would be a unique opportunity. But beyond all this, the European Respiratory Society is insisting on the fact that we develop common projects, be it guidelines, be it research seminars, be it writing monographs on different topics, be it common educational projects. I just remind you that we had a very successful joint course on lung cancer in February this year. So all this is open not only to leadership but to all members. Mm-hmm. You have an idea, you wish to go into a project, forward it, and we will do it.